Since October 2010, Haiti has experienced the worst cholera epidemic recorded in the world in the last century. In a country devastated by the earthquake, cholera spread quickly and mortality was very high. The disease has killed more than 6,000 people in slightly over a year. Cholera is a disease that goes very fast. So if the patient does not reach a specialized treatment center, he or she can die within hours. Cholera is a disease caused by bacteria that lives in water and feces. Most people get infected when they drink or come into contact with contaminated water.
Quand on parle de choléra, on parle de diarrhée.
When we talk about cholera, we talk about a diarrhea and a race against the clock. A patient can lose more than 1 liter of liquids per hour, depending on the quantity of toxins he has ingested. It is a disease that is easily cured if you rehydrate the patient. In very severe cases, we use antibiotics, but the disease can be controlled if we do oral rehydration.
On donne une réhydratation adéquate par le biais de sérum oral.
The European Commission's Department of Humanitarian Aid and Civil Protection, ECHO, allocated 22 million euros to respond to the cholera epidemic when it started, and an additional 5 million euros in 2011.
ECHO's response has been threefold. First, we wanted to make sure that patients were taken care of adequately. For this, we also need to strengthen the surveillance system. We need a clear picture of who was getting sick, where and when. Finally, the solution is prevention. And to prevent cholera, we need to have better hygiene, we need to have enough access to safe water supply, and we need to improve the sanitation.
The aid provided by the European Commission has helped fund cholera treatment centers like this one run by International Medical Corps in Les Cayes in the southwest of the country.
From the recently joined hygienist to the CTC, the Cholera Treatment Center supervisor, each of these are the real heroes. They are the ones that made the difference. When we received the CTC, the Cholera Treatment Center, they were like 14% mortality. And now it's less like 0.6%, which means that huge difference. They made the difference by their dedication, by their initiative, by their motivation.
The population of Haiti had not been exposed to cholera for a century, so when the disease came, people were not ready. For us, it is the first time cholera has hit us in Haiti. So at the beginning it was tough, because we faced a disease we had never heard about. Of course, you study it in the medical books, but for the people and us as doctors, it was the first time we faced this type of situation. Thanks to international humanitarian aid, we have been able to overcome this a bit faster.
To build the capacity, the national capacity of the national Haitian doctors and staff. Actually, that was a key point. It was the cornerstone to make sure that we progress up into what we call sustainability. Because sooner or later the international community will end the emergency phase, and who will be left here to deal with this epidemic outbreak of cholera are actually the Haitians.
Fighting cholera is not just about treating patients. The solution lies in prevention, in ensuring people drink from safe sources and that grey waters are disposed of correctly. This is why the Commission also helped to increase awareness about cholera among the population and about what to do to avoid getting sick. Water, sanitation and hygiene activities are crucial to winning the battle against the disease. This disease came to a country where there was hardly any infrastructure in terms of sanitation. Drinking water was not available for all the population, nor were latrines, and sanitation and waste disposal systems were insufficient.
Donc, le choléra, donc je peux dire...
We can say the disease found good ground to flourish. And that's why I think that is the biggest challenge to fight cholera in this country.
Pour combattre le choléra dans un pays pareil.
Les gens sont beaucoup plus au courant.
People are now much more aware of health education rules, like washing hands, wash the food, boil it, do not take food that is underdone, and be vigilant as to what water sources they drink from.
Ils s'abreuvent.
Cholera will remain a problem in Haiti as long as the population does not have access to safe water and proper sanitation. The epidemic is turning endemic, and the country is learning how to cope with it. Through its humanitarian partners in the field, ECHO will continue to support the local authorities to better respond to the disease.